the health fair, which is going to
Mhm.
happen next month.
Yes.
Can you tell us a bit about that?
Okay. Well, and as I told you, I was kind of shifting away from this acute care clinics and been doing the screening for cervical cancer and breast cancer in the last 3 years or so. And for the last 2 years, actually, because of COVID, we couldn't go on the usual trips to go and do. We used to go every summer to go. And, you know, one thing I found out is that even if we don't have people going with us from here, we would still go and do it. And this year in October, well, before is we are going to have a health fair for women in Accra. And as I started planning, I decided, well, I needed to have partners who are interested in this kind of thing. And so we are partnering with about 4 or 5 organizations, and we are going to have the health fair at the College of Physicians and Surgeons near Ridge Circle in Accra. We will be screening, we'll do the usual blood pressure, you know, blood sugar tests and so on. And then we'll have a lab that will be there. We'll have other providers of healthcare, like we'll have a chiropractor, a massage person, an exercise physiologist trainer, and then we would also be screening for cervical cancer and breast cancer using some mobile devices. And there would also be clinical breast exams as well being done. So I talked to you about the other partner that I mentioned is actually Bator Catholic Hospital in Bator in the Volta region. And there is a fantastic doctor, OBGY, Dr. Kofi Efa, who is very interested in bringing cervical cancer screening and breast cancer screening to the community, as opposed to, like you said, it's not many people who will get up and go. A market woman in, you know, whichever market, she's busy selling her wares. She's not going to get up and say, okay, I'm going to get screened. But then if you take it to the people in the community, then it would work. And so he has been doing it. And over the years, he's established a center where they train nurses and midwives, community health nurses. They go through a training of screening women in the community using very basic means, but being able to detect any pre-cancer lesions, where then they can be referred to a hospital which deals with, you know, using more sophisticated equipments to detect whether those screening tests were pre-cancer lesions or actually cancer. Yeah. So some of the graduates from that training will be on site to do the screening. Yeah.
So obviously, there's been lots of collaboration. I mean, organizing these events, and I guess it's been so over the years. And that leads me to the next question about what are some of the challenges that you faced since you started going back, giving back?
I just want to encourage people that, look,
Yeah.
if you live abroad and you want to go and do something in Ghana, there will be challenges. Don't think that just because you're coming from here, whatever you say will be accepted or so
Yeah.
on. But I think that you have to push your way through, press your way through, and find people who have like passion like you do, so that you can work with them. And that is what has happened. I have, over the years, we've gotten to know a lot of people. We've got to, in the different medical areas, we've got to have friends in that area. So we would, we would invite them to come and help us. We have, for example, a regular lab scientists who would always come and do our malaria, blood sugar and all that. And when we call upon him, he's always there. Like we said, we've also worked with the Cervical Cancer Prevention and Training Center in Bator. So whenever we call them, they would come in, and do the screening for us. And so you have to be patient, even if you start and you face roadblocks. Yeah, you find out that, sometimes another door will open when one closes, and so that's something. And then logistics, it takes a lot of time and effort to do things in Ghana. Everybody will tell you that. So the logistics, even if we are going to have a clinic, and remember, we used to do 3 clinics over 2 weekends, and so you have to get the people. People may agree that they would come, but then when it's time to pick them up, they don't show up, and so on. So there's a lot of logistics, transportation, and so on and so forth. But God is our helper, and he's helped us to get through. But there are faithful people in Ghana that you have to realize who can join with you, and they may not be able to have the finance or whatever that you may be bringing to help with the clinics, but they avail themselves. And a lot of them that we work with, they would not ask for anything.
So true, it's so important, the importance of building relationships, maintaining those links over the years, because you can't do it alone. You can do it alone. It's very, very, very important. And it's something that keeps coming up again and again. And also, when you were talking about the challenges, and you mentioned something that you need to push through. And the thing with that is, if you don't have the passion, you would, the slight obstacle will just discourage you. So there's got to be something in you that, that passion that drives you, and that kind of, overcomes any obstacle or whatever is, is blocking you. Yeah. Whoa. So thank you for that. Okay. So, Dr. Entsuah, my next question is the African diaspora and development in Africa. I mean, it is widely believed that the African diaspora, we are integral to the development of Africa. And in this case, I'll talk about Ghana. So what is your take on that?
Well, thank you for that question. I think that we have a tremendous role to play in the development of Africa, whatever country we come from, or whatever country we choose to work in, because there are many people on the ground, and it may not even be, it may be a device, for example, that you have come into contact with, which you feel may be appropriate. It's appropriate technology for your country. For example, I came across what they call the EVA colposcope. This is a mobile colposcope used to screen women for cancer, approved by WHO. And I came across it and I said, wow, this is a good device to use outside of a hospital or outside of a clinic, because most of these places, if they have any at all, it's a stationary colposcope, okay? And it's usually used to have a closer view at the cervix. And it's usually stationary, which means that it's a big thing sitting in an office. But then there was this small mobile one, which had a cell phone attached to it, a smartphone. And people were using it in Mexico, in Uganda, in Kenya, and places. And I said, wow, this can be used in Ghana. So I actually purchased one and said, okay, on my next mission trip, I'm going to go to the corridors of government and see whether there's anybody who will be interested. So I did go to the corridors of the Ghana Ministry of Health, Ghana Health Services. And there were a couple of people who thought it was a good idea, but it didn't go very far. And so then somebody introduced me to Dr. Kofi Efa and said, look, he's the guru of cervical cancer screening in Ghana. So I met with him, showed it to him. He got very excited because he said, then my nurses that I'm training can use this on the field. And the rest is history. And so during their training, they train the nurses with this mobile colposcope. And now there are many different types of mobile colposcopes available that he's training people to use, you know. And because of that, there are also some doctors who have even purchased it and all that, and other hospitals, you know, have purchased it. Somebody took some to Sudan and so on. So you see, it may be a gadget or something. And I'm very much interested in mobile health devices that can be used because that is what we need in our system. You know, so apart from the colposcope, I'm going to be to work with somebody who has something for checking children's eyes, for example, you know, for eye conditions, which can be used on the field. And lately, there's another device for breast cancer screening, you know, which is slightly better than clinical breast exam that is done by a professional. So these are all mobile devices that are across the world and are being developed. And so somebody can look at that and say, hey, this is something that may work. And if you go to your government offices and nobody or somebody, they are not interested or that's not on their radar or whatever, look for people who can help you, you know. So that's the thing. And like you said, we have to develop partnerships with people on the ground who have the passion for the same passion that you have and are willing to work with you. And don't give up, like we've said, you know. So yes, we who are in the diaspora have, and some people may go and teach, for example, you know. There are physicians here in the US who belong to the Ghanaian Physicians Association in the US, who every year prior to the pandemic used to go when they are having big continuing medical education in the Ghana College of Physicians and Surgeons and go and give lectures. I had even done some earlier on, but I haven't for years because of my time being used with the NGO, if you see what I mean. But there are other groups. I know of a physician in Minnesota who has a group which also do training of health professionals. So even if you are a nurse abroad and you are in academia, for example, you can go talk to the people at the College of Nursing and Midwives or whatever, see what you can go do. So yours is maybe education. Somebody's is hands-on on the field, you know, somebody's is even writing articles and so on. There are so many endless opportunities for us. So let's get involved.
Thank you. Thank you. You summed it up well. So my last question is, you know, your general, I think you've even answered that, you know, the general message for African diaspora healthcare professionals or healthcare professionals who are in the diaspora generally.
Yeah.
Yeah.
Mm-hmm. Well, like I said, if you are passionate about something here, maybe you could do a transfer to your country. You know, if you are passionate about something here or in your work here, there's something that you find out, oh my, this will benefit my country. So you go and you do the groundwork. Okay, don't think that just your one trip there would make a difference. you have to be consistent, be persistent as well. Don't give up. And everybody can do something. Everybody is capable of helping their counterparts back in Ghana or elsewhere.
Thank you so much, Dr. Entsuah. You summed everything up. So the passion, the links, start small, talk to people, and above all, I think make the move or take the step. Because I know I've spoken to so many people. People've got ideas. I want to do this, but then I think that last step of just taking the first step is always difficult. Yeah, but it can be done. Thank you so much. I know that our conversations have largely shifted probably to the screening and everything, but I know there's a lot more with education that I hope that probably another time we can talk more into detail about the work you're doing with the school kids and all the Christmas boxes and everything that we haven't touched on. So your NGO's website, can you tell us the name if anybody wants to look that up?
My NGO website is mygatewayofhope.com.
Yeah.
mygatewayofhope.com.
Yeah, I'll add it into the description box so anyone can go there and have a look. And also, before you go, the books that we mentioned earlier, the books that you've written, can you mention them again and talk about where, if people want to have access, where they can get it?
Okay, so my first 3 books were written like 2000. The first one started 2013, I think. So it's been a while. But I need to go back and, maybe put it on Amazon and all that. But Kingdom Bookshop used to have copies of the first 3. The one on sexual abuse, the one on safety for kids, and the parental guide. But my last book is this one. I hope it's showing right, but it's the Woman's Guide to Her Body and Total Health. That is available on Amazon, and in Ghana, it's available in the university bookshops. It's available at Kingdom Bookshops, EPP Bookshop, Challenge Bookshop, Ernest Pharmacies. So they are all there. And then booknook.org. It's an online bookshop in Ghana. So they are available in all those places. And that is the latest thing I'm pushing, because in my work, both here in Ghana, I find out that a lot of people do not take care of themselves in terms of their chronic medical conditions and so on, or they do not know much about their own body and the sicknesses and diseases that may affect them. So I did this book. It's from head to toe. Every common disease is in it, and what you can do at home to help you, or to even know, so that when you go and see the doctor, you have a meaningful conversation with your physician. And so that is what this book is about. It's a guide. So it's a very fat book, but I don't expect you to sit down and read every page, but you turn to the relevant topics and read on that. That's basically what it is.
Thank you so much, Dr. Barbara Entsuah. It's been a pleasure talking to you. Like I said, I think with all the work you're doing, we probably touched on about maybe 40%, 50%. So there's a lot more that we need to talk about. So hopefully we will, have another conversation another time. And thank you so much for your time. And I wish you well in the Women's Fair next month.
Ghana, we now have freedom.